SI4ARE, Social Innovation for Integrated Healthcare of Aging Population in Adrian Regions. SI4ARE aims to tackle the needs of Adrian aging population by creating a collaborative environment where it is important to co-design solutions and engage a large transnational community that represents all relevant stakeholders.
In the pilot project, we are analyzing different aspects of the accessibility of integrated long-term care services for older people in geographical information systems. In Slovenia, for example, there are more than 50,000 people aged 80 and older who live completely alone at home. We will show the problem areas to local decision makers and caregivers in order to organize better services as well as transport for older people.
It is estimated that about 70% of people in care homes experience dementia or severe memory problems. The pilot opening unit for residents with dementia in Horjul included redesigning the outdoor areas of the park, adding circular pathways and a sensory way to allow the residents free movement outside of the care home with raised garden beds, facilitated garden activities, placing Montessori and other accessories to promote non-pharmacological care, and redesigning indoor areas, making plan to changing the concept of care to person-centered care.
Pregled stanja dolgotrajne oskrbe v Sloveniji je pokazal, da se tako starostniki kot deležniki strinjajo, da obstaja problem dostopnosti rehabilitacijskih storitev pri nas. To je potrdilo potrebo po biomehanskem pilotu, ki ga izvajamo. V tem pilotu imamo dve skupini starostnikov, po 12 udeležencev. Ena vadi v živo, dvakrat tedensko v fitness centru, druga pa preko spleta, preko Zooma. In po 3 mesecih bomo obe potestirali, opravili meritve, da ugotovimo vpliv treninga na neko fizično stanje in pa dobro počutje.
Pripravljamo pa na inštitutu še en pilot, in sicer na temo srčnega popuščanja. To je resna in precej pogosta bolezen med starostniki, katere obvladovanje je precej kompleksno. Zahteva ustrezno telovadbo, prehrano in še marsikaj, čemur veliko starostnikov ni kos. Zaradi tega bomo testirali mobilno aplikacijo, ki jim s pomočjo metod umetne inteligence pri obvladovanju bolezni pomaga.
The main objective of Municipality of Migirina pilot action is to demonstrate a way to improve quality and accessibility of the healthcare system by the elderly, by using the ICT solution and by enhancing the diffusion of telemedicine services in Migirina and the neighboring municipality. The development of remote healthcare services is aimed at the needs of continuity of care and assistance for patients suffering from chronic disease requiring a evaluation of a non-clinical picture, also including people suffering from rare disease that require constant contact with health facility and hospital and territorial reference health workers.
Jedna od projektnih aktivnosti je izrada i primjena pametnih naruknica. Pametne naruknice će se primjenjivati kod osoba starije životne dobi gdje će se mjeriti zdravstveni parametri, učinkovitost primjene pametnih naruknica i isto tako reagiranje žurnih službi u slučaju promjene zdravstvenih parametara. Vrlo je važno pratiti te parametre kod starijih osoba u realnom vremenu kako bi mogli planirati preventivne aktivnosti, odnosno predlagati primjene i promjene zdravstvenih politika vezano za zdravstvenu skrb starijih osoba.
The centralized healthcare system of Federation of Bosnia and Herzegovina is one of the main reasons for the lack of data on leading disease in the elderly population. The main goal of our pilot action is to identify system weakness and to plan better healthcare for the elderly population. In order to achieve the main goal of the pilot, it is necessary to develop a unified database on diagnosed disease and provided health services in the elderly population. Based on the data from the database of healthcare services in Federation of Bosnia and Herzegovina, solutions for better provision of health services and suggestions in creating health policy for the elderly population would be proposed.
In collaboration with the second healthcare administration of Piraeus and the GNC, we designed the new specialized memory, dementia and Parkinson's disease outpatient clinic through the National Telemedicine Network. Given the importance of physical exercise in the elderly and the difficulties in implementing regular exercise programs for them, we developed an online live program of tele-exercise in collaboration with the Physiology Laboratory of the Medical School of the University of Athens. In order to support active aging, we sought to help elderly people to stay active drivers. Thus, we created an online consultation program for safe driving on an individual basis through our collaboration with the National Technical University of Athens.
S obzirom na to da je analiza stanja zdravstvenih usluga za starije, koja je obuhvatila sve relevantne stakeholdere, pokazala nedovoljne mogućnosti korištenja savremenih informacionih tehnologija u pravcu pružanja kvalitetnih usluga, naša pilot aktivnost ticat će se poboljšanja sistema komunikacije sa pacijentima na ovaj način. Kroz jačanje informaciono-komunikacione infrastrukture pokušat ćemo da dođemo do softverskog rješenja koje će nam obezbijediti sa jedne strane bolju i kvalitetniju bazu podataka o našim pacijentima, a sa druge strane pacijentima ćemo olakšati pristup našim uslugama putem telemedicine i na taj način pružiti im kvalitetniju zdravstvenu zaštitu.
The pilot project in Merkur is called Use of Telemedicine for Remote Health Control for Patients with Diabetes for the age 65 plus. The topic of telemedicine was chosen based on the status quo analysis in Serbia and the challenges identified.
So far, we have 10 patients in the pilot, but the recruitment still continues. Patients are satisfied with their participation in the project, especially due to the fact that they can, on a daily basis, contact the doctors and specialists using mobile application and digital platform.
Central Macedonia Regional Authority decided to implement the pilot project Click for Life, offering telemedicine home care assistance to senior citizens with special needs living alone through the use of wireless medical devices and a 27 helpline. The pilot project, the first of its kind in Greece, started in 2021 with 3,000 senior citizens beneficiaries so far, with great results judging from the positive responses of the users and the high demand from the elderly population of the region. Therefore, we believe that through the Adrian project SI4ARE, it would be a good opportunity to review the project Click for Life and continue it with more and improved services for the elderly.
SI4ARE, social innovation for integrated healthcare of aging population in Adrian regions.